Some of the best messages that I get are those of you that say, I followed a lot of what you said. I feel so much better. These messages keep me inspired to keep going. I know there's a lot of you out there that are still kind of floating on that surface, trying to get over that hump of healing. Between feeling bad and healing is just a little step away, but you're not there. You still feel the same effects of what you're dealing with. Some days are better than others, and you're kind of in this roller coaster of when is this going to end? When do I put a stamp on this as complete and move on to something else? Well, I'm going to tell you, it's pretty difficult to heal from this condition of eustachian tube dysfunction and tinnitus without healing the mind first. Sometimes our bodies does these very mysterious things so that way we can kick our health back into good shape. I want to tell you that when I was dealing with this condition, my health was not where it needed to be. It's seldom that you are in the best shape, best health possible, and you have this condition. It's very seldom. It's possible, but there's always some improvements to make when it comes to things that you can do for yourself. And that's why I stress a lot about the mind. And the reason why it's not being talked about is still very puzzling to me. Now, I don't hold an accreditation of a specialist or a physician to be able to discuss the things you all need to do, but I do have one thing that I can tell you, and that is the experience of going through it myself. A lot of physicians haven't gone through this condition. They're treating it in a sense that they're very inclined of some of the things that you may feel, but they're not touching on everything. And a lot of that could be due to lack of time, lack of resources, and maybe just lack of communication with their patients. And that's where I feel like there's a gap between getting this condition and healing from this condition. Obviously, if it was all up to just taking nasal sprays, doing the decongestants, and just cleaning the ear and saying come back, then we wouldn't have all the people we have that are still struggling and continue to struggle for many months and years now. Now, I'm going to tell you that I do touch on mental health quite a bit because I'm going to tell you that it's the driving force of why you still have it. And some of you watching this video, what are some ways to get through that? Well, I'm going to tell you, I'm going to lay down some very simple things you can do to get through some of the mental aspect of dealing with this that's keeping you down. One thing that I've noticed when I was struggling with this condition myself is that it was too easy to cancel things. I was always feeling a certain type of way when it comes to the clogging, the clicking sounds. Some of you describe it as like the popcorn crunching sounds. Well, it got so unbearable that I began to just make excuses on doing things in life. Basically, I would cut corners on going out of town because it was just too much to get away from my comfort zone. I would be leery of going into mountains, getting on planes, riding in trains. It was starting to get too easy to just say, no, I'll do it this way. I'm going to tell you right now, when you cancel something that you need to do, whether that be an obligation or just for your enjoyment and your family's enjoyment, you're feeding the opportunity of eustachian tube dysfunction. You're feeding eustachian tube dysfunction to last longer. And let me explain why. Some of you are like, what are you talking about? How are you feeding the condition? Well, every time you cancel something that you think you might not be able to do, you're going to set your mind up to feel that everything you do out of schedule or everything you do extra than your normal activities is going to lead to a very, very unforeseen circumstance. So if you have a trip scheduled and you didn't feel very confident when you booked the trip, but it's getting closer now, and now it's getting closer and you're still not feeling well, you probably booked the trip thinking you were going to feel well and you don't, and actually you probably feel worse. And so as the date starts to approach, you realize you're not any better than you were when you booked it. You're actually worse. Well, 2 or 3 days before the trip, you decide I'm going to cancel and I'm going to just figure this thing out. I'm going to cancel whatever you had planned with whoever you had planned with. Well, it almost seems like you're doing the right thing because you feel like, okay, I avoided something major happening to me. But that's where the mind gets in the way. That's where this mental crutch starts to strike all of you down. Because I've done that many times. I played this approach for years, thinking that I was avoiding something. I was actually feeding the possibility of not doing it the next time, not doing it the next time, not doing it the next time. Well, when you feed something, it becomes full, and it just accumulates. Every single time you cancel something that you feel like you can kind of do, but you don't want to go through all of that. Now, let me just throw a disclaimer out there. If you're dealing with any pain, loss of hearing, loss of vision, anything severe that you feel like you should not go and attend anything other than to go to a doctor's office, please, this isn't what I'm saying. Cancel your trip. And I'm not saying to ignore your symptoms and go do things. What I'm saying is, you just have this apprehension, like I had. You have this apprehension of not doing those things, but you don't feel severe or anything. You just feel like it's not going to be well. You're not going to do well. You're not going to be in a good state of mind. Well, I want to tell you right now, if you're in that position where you're canceling that, you're hitting the cancel button on so many things, opportunities, things to do, even enjoyment factors, even things that make you feel good, you don't want to do. You're aiding into, basically feeding into that mental lie that something's going to happen to you. And so I just want all of you to know, if you're in that position, the best way to conquer this condition is to actually go do those things. Put yourself out there, even if you feel like it's not going to go well, because whoever you're with is probably someone you care about, and it's probably someone that cares about you. They're going to understand it, most likely, that you're doing this because you want to still live your life, but just keep them abreast of what's going on. Let them know, hey, I'm going to go, but just giving you a kind of pre-warning, I may have a little battle I'm dealing with, because that's what's happened to me. I was leery about doing certain things, mountains, trains, you name it, buses, planes. And I eventually got to the point where I was confident enough that I was just going to do those things anyways. Because I realized if I keep canceling things, I'm just going to add more of a layer to my mind telling me I can't do those things anymore. And then it's just going to get worse and worse and worse and worse. It's like if you notice yourself gaining weight, it's harder to lose a lot of weight than a little bit of weight. So if you stop yourself in the midst of feeling like, okay, I need to just go live my life, I promise all of you that if you're not in a severe state, of course, I'm talking to a certain group of you. If you're not in a severe state and you're not at a position where you feel like you need to seek medical attention urgently, you need to try your absolute best not to cancel things and just go through with them. Because as you continue to do those things, even while you're doing whatever it is you're plan to do, you still might not feel that well. But what ends up happening is you develop a sense of mental trust between the mind and the body. And when you develop this sense of trust between the mind and the body, you inevitably conquer the apprehension that you had, that you thought you couldn't do something. You end up conquering that feeling. And as you develop the strength and the awareness of your potential, the next time gets easier, and then the next time it gets even easier. And as you continue to keep doing that, it gets better, and the problem factor becomes not so close to your awareness. So what do you mean? Well, as you continue to live your life despite not feeling 100%, whatever it is that's bothering you becomes less of in your face factor and more in the background, like elevator music, where you are aware of it, you know it's there, but it's not affecting you on the surface. So you're still able to do what you need to do and live your life the way you need to live. Now, if this isn't a remedy to stop everything in its tracks the minute you decide to go somewhere, but I promise you, from just experience and what I've heard and what I've studied for so long now with this, the more you keep this train of thought, this process. Okay, I'm gonna go. I'm gonna tell you that's exactly how it happened for me. I eventually said, I'm gonna go to the mountains. I'm just gonna prepare myself. And be just ready for whatever happens. But I'm not gonna shy away from this. I'm gonna face this anxiety. I'm gonna put my face in front of it, and I'm gonna challenge it, and I'm gonna do it. And as you keep doing that for different things that you were always a little leery about, again, the problem becomes smaller and smaller and smaller until it becomes so irrelevant that is almost just like nighttime noise, and you don't notice it's there. So like, like just sounds of the outside world. They're there. You hear them. If you would really stop and listen, okay, I know it's there, but it doesn't bother me that it disrupts what I'm doing, my flow of things, and what I have to do right now. So I think a lot of you may not be told these things. You feel like with all the medication you're given, all the whatever it is you're giving, I don't know if a lot of you are giving guides in the doctor's office or things that are going to help you, but whatever it is you've been given, you need to take all of that, take whatever it is you have. I'm not telling you to change everything, but I'm telling you to be a little more confident in your body's abilities, in your mind, and to be able to challenge whatever it is you feel that you cannot do and actually go and try to make yourself do it. Of course, all of you most likely watching this video are probably adults, and you can kind of gauge when you should sit things out or when you should pause on things or when you should just go ahead and do things. Because a lot of you probably have a lot of very important events scheduled, and you don't want to miss those opportunities because some of those might only come around one time, and you don't want to miss that train. So I hope this video was very helpful for you. If it was, please take time to subscribe to the channel. I try to bring content as often as possible. But in the meantime, I'm going to step out of the J Wellness studio and leave you in good hands with this video. Like anything else, folks, we're here to simply go back to the basics. Take care, everybody.